You exercise 5 days a week. You eat clean. You don't smoke. You sleep 8 hours. You are, by every measure anyone would use, healthy. And yet, every single year, thousands of people exactly like you drop dead from a heart attack without a single warning sign. Here's the number that should stop you cold. Nearly 50% of people who suffer a first heart attack had absolutely no prior symptoms. None. Zero. They felt fine the morning it happened. So today, I'm going to show you 3 things. First, why feeling healthy is one of the most dangerous illusions in modern medicine. Second, the hidden mechanisms silently building toward a cardiac event right now inside people who look perfectly fine. And third, the exact steps that actually prevent heart attacks beyond the basics your doctor probably never told you. Stay with me. This one might genuinely save your life. Let's start at the beginning. How does your heart actually work? Your heart is essentially a pump, a muscular, fist-sized pump that beats around 100,000 times a day. It needs a constant supply of oxygen-rich blood to keep working. That blood is delivered through coronary arteries, the pipelines of your heart. When those pipelines stay clean, open, and flexible, everything runs perfectly. You feel nothing. You feel great. But here's where it gets interesting. Think of your coronary arteries like water pipes in an old house. From the outside, the house looks completely fine. Fresh paint, nice garden, no leaks visible anywhere. But inside those pipes, years of mineral buildup, slowly narrowing, slowly hardening, slowly becoming fragile, completely invisible until one day a pipe bursts. That's exactly what happens in a heart attack. And here's the part most people get completely wrong. Most people think heart attacks happen when an artery gets so blocked that blood just can't get through anymore. That makes sense, right? The pipe gets clogged, flow stops, heart dies. Logical, simple. It's completely wrong. The majority of heart attacks are not caused by a massive, old, hardened blockage. They're caused by something far sneakier. A small soft plaque buried in the artery wall that suddenly ruptures. When it ruptures, your body panics and sends clotting agents to seal the wound. That clot forms in seconds. That clot is what blocks the artery and kills heart muscle. Here's the terrifying part. Those soft, unstable plaques, they don't always show up on standard tests. They don't narrow the artery enough to cause chest pain. They give you absolutely no warning. You feel completely fine right up until you don't. Now let me introduce you to someone. Meet Marcus, 41 years old, runs 3 times a week, non-smoker, gets his annual physical every year. His doctor always tells him his cholesterol looks normal, his blood pressure is fine. Marcus eats mostly whole foods, drinks socially on weekends, and gets decent sleep. By every metric his doctor measures, Marcus is healthy. 6 months ago, Marcus had a heart attack while mowing his lawn on a Saturday morning. He survived, barely, and in the hospital, the cardiologist told him something that floored him. Marcus, you've had this building inside you for probably 15 years. How? How does this happen to someone like Marcus? Because what Marcus didn't know, what nobody told him, is that his standard checkup was only measuring the surface. It wasn't measuring particle size of his LDL cholesterol, which determines how easily it penetrates artery walls. It wasn't measuring his LPA, a genetically inherited lipoprotein that dramatically accelerates plaque formation, present in roughly 20% of the population. It wasn't measuring hsCRP, an inflammation marker that signals whether his arterial walls were under attack. And nobody ever gave Marcus a coronary artery calcium scan, a simple, low-radiation CT scan that would have shown exactly what was building up in his arteries. Marcus didn't have bad habits. He had invisible risk factors nobody looked for. And he's not alone, because what happened to Marcus is being quietly repeated in gyms, offices, and living rooms everywhere. So let's pull back the curtain on exactly what's hiding. Genetics. Familial hypercholesterolemia affects 1 in 250 people. It causes dangerously high LDL cholesterol regardless of how clean you eat or how hard you train. You were born with it. Your salad didn't cause it. Your salad won't fix it. Chronic inflammation. Low-grade systemic inflammation silently erodes your arterial walls, making them vulnerable to plaque and rupture. What causes it? Poor sleep, chronic stress, undiagnosed gut issues, even gum disease. None of these look dangerous. All of them are. Metabolic dysfunction. You can have a completely normal body weight and still have insulin resistance, elevated triglycerides, and blood sugar creeping toward pre-diabetes. This is called metabolically unhealthy normal weight, and it's far more common than most people realize. Normal on the outside, chaos on the inside. Welcome to the illusion of health. Sleep apnea. Millions of people, many of them fit athletic people, have obstructive sleep apnea and don't know it. Every time you stop breathing at night, your oxygen drops, your blood pressure spikes, and your heart takes a hit, night after night, year after year. It's a major independent risk factor for sudden cardiac death. Chronic stress. Stress isn't just feeling overwhelmed. Chronic psychological stress floods your body with cortisol and adrenaline, raising blood pressure, promoting clotting, and causing arterial spasm. It is a clinical cardiac risk factor, documented in peer-reviewed research, not a soft lifestyle issue, an actual mechanism that kills people. Here's the good news, and there is genuinely good news. Your body is not passive in this process. It's constantly trying to protect you. Arterial walls have adaptive mechanisms. Inflammation can be reversed. Plaque progression can be slowed and in some cases stopped entirely. The cardiovascular system is remarkably responsive to the right inputs. The key word is right inputs, not just the ones we've been told matter. And that brings us to what actually changes the outcome, because knowing the risk is only half of it. Let me be completely direct with you about the stakes here. By the time a heart attack happens, the disease has typically been building for 10 to 20 years. The moment you feel chest pain, the damage is already done. Waiting for symptoms is not a strategy, it's a gamble. And statistically, it's a gamble a shocking number of people lose. So here's what I'm calling the deep check protocol. 5 things that go beyond the basics and actually catch real risk early. Step 1. Get the right blood tests, not just standard cholesterol. Ask your doctor specifically for ApoB, a far more accurate measure of dangerous particles than LDL alone. Lp(a). This is genetic, it only needs to be tested once, and if it's elevated, it changes everything about how aggressively you need to manage your heart health. Fasting insulin and HbA1c to catch metabolic dysfunction before it becomes diabetes, and HSCRP to see if your arteries are inflamed right now. Step 2. Get a coronary artery calcium scan. If you are over 40 with any family history of heart disease or even without it, this scan is one of the most valuable things you can do. It's inexpensive, low radiation, and it gives you a direct window into what's actually happening inside your arteries. Not estimates, not calculations, actual data. Step 3. Treat sleep like a medical intervention. 7 to 9 hours non-negotiable. If you snore, wake up exhausted, or feel foggy in the mornings, get screens for sleep apnea. Treating it has been shown to significantly reduce cardiac risk. Step 4. Manage stress with the same seriousness you manage exercise. Breath work, meditation, therapy, boundaries at work. These aren't luxuries, they are cardiovascular interventions. Box breathing and 4-7-8 breathing have measurable effects on cortisol and blood pressure. Use them. Step 5. Know your family history in detail. Did any first-degree relative, parent, sibling have a heart attack before age 60 if male, or 65 if female? This is one of the single most powerful risk flags in medicine. If the answer is yes, you need earlier, more aggressive screening. Not eventually, now. One warning. The most common failure here is doing step 1, getting normal results on standard tests, and walking away reassured. Normal on the wrong test means nothing. Push for the specific markers I just listed. A standard lipid panel in 2025 is like checking the exterior paint on Marcus's house and declaring the pipes are fine. And if you're pregnant, already on cardiac medications, or managing a complex condition, speak with a specialist before making changes. This information is for general awareness, not a replacement for personalized medical advice. Here's the truth that nobody in mainstream medicine says loudly enough. Most heart attacks are preventable. Not most of some heart attacks, most of them. But prevention only works if you go looking for the right things before there's a reason to. The heart doesn't send you calendar invites. It doesn't give you a grace period. The disease is silent, patient, and decades in the making. You have two paths right now. You can close this video, feel relieved because you feel fine, and keep trusting that your annual physical is catching everything that matters, or you can decide that feeling fine is not the same as being fine, and take one concrete step this week towards actually knowing what's happening inside your body. You already know which one Marcus wishes he'd chosen. If this changed how you think about heart health, comment deep check below. It tells me this reached someone who needed it, and it just might remind you to actually follow through.